For Global Medical News Network, I'm Heidi Spleet, reporting from the National Foundation for Infectious Diseases Influenza News Conference in Washington, D.C. This year, for the first time, physicians in the United States are recommending flu vaccination for everyone older than 6 months of age. Public health officials and medical experts convened at a press briefing in Washington, D.C. to encourage vaccination.
This year, we think that the 3 strains of influenza in the flu vaccine are going to be excellent matches with the flu that's circulating. From the laboratory data that we've seen in this country and around the world, all 3 components are excellent matches with the kinds of flu that people are likely to get this year.
What advice do you have for physicians about vaccinating all the personnel in the office?
Well, certainly this year, I think just in terms of what you get to tell them is going to be a lot easier, because the recommendations this year are that all people over 6 months of age should get vaccinated. So the message that we're trying to get out to folks is going to be simpler. In terms of letting them know about getting vaccinated, it's important that they understand that they're protecting themselves, but they're also protecting their own family members so that they don't take an infection from work and bring it home to their kids, but also they are protecting the patients that they're seeing. And so that's an important thing from a patient safety standpoint, but also from a personal protection standpoint.
What's the message for physicians to tell parents about children getting other vaccinations on the same day as the flu vaccine?
In general, the flu vaccine can be given with other vaccines. Obviously, the physician will go through the schedule and see exactly what vaccines are being given at that time. But in general, it can be given with all of the other vaccines.
What advice do you have for physicians if patients come in looking for vaccines, but the physician has not yet received their supply in the office?
Well, my doctor says he just wants me and my wife to be protected. I get mine at the hospital. That's fine with him. My wife actually goes to a pharmacy, and she says that's wonderful. So my physician says the important thing is not who delivers it, but that the patient is protected. The recommendation is, for the first time this year, that we vaccinate everyone. We need as many people helping us vaccinate as we can possibly get. We can't do it all in our offices. No way that we can immunize 300 million people at a stretch.
For Global Medical News Network, I'm Heidi Spleet.